Self-monitoring blood glucose.
How to self-monitor blood glucose?
How? Get yourself a glucometer, glucose strip, lancet, alcohol swab, and clean cotton. Remember to record each reading and types of meals in a diary.
How to get the glucose reading?
Twist the top part of the lancet and remove it. Put the needle and twist the top of the needle to expose it. Put the top of the lancet back and set the number to 3. The number is depend on the skin thickness. Pull the back of the lancet until a click sound is heard and release. The lancet is primed to use. Ensure the battery of the glucometer used is of its specific code. Put the metallic part of the glucose strip into the glucometer. The device should turn on and ensure to check the calibration code are matched. Wash your finger with alcohol swab and let it dry. Use the lancet to prick the side of the fingertip to reduce pain, and wipe the first blood with clean cotton as it may be contaminated with tissue fluid or debris. Only take the second blood that comes up. Put a little drop of blood on a test strip. The glucometer will give your reading. Twist the top part of the lancet and remove it. Put the circle part of the needle on a flat surface and stick the needle onto the circle. Discard the needle into a sharp bin or a plastic bottle. Put the top of the lancet back. In fasting, the reading should be between 4.4 to 7.2 millimole per liter. After meal, the reading should be less than 10 millimole per liter. For patients using 4 or more insulin injection, at least 4 readings should be taken before meal, 2 hours after meal, at bedtime, and in presence of hypoglycemia. Patient type 2 DM taking single insulin injection and anti-diabetics, at least 1 reading is taken either during fasting or before meals. Patient type 2 DM taking insulin secretagogues, glucose reading is taken at first sign of hypoglycemia. Type 2 DM patient taking anti-diabetic medication without risk of hypoglycemia or lifestyle risk, glucose reading is not required.
Why people should use self-monitoring blood glucose? To identify and confirm hypoglycemia in people using insulin and hypoglycemic agents. To reassure the patients that their disease can be controlled. To provide data to support patients and healthcare providers in making tailored advice about lifestyle and glucose-lowering medications. And to reduce complications. Medication storage. Unused insulin pen is stored in 2 to 8 degrees Celsius fridge, while used insulin pen is stored at room temperature for until 1 month. Do not freeze, do not expose to sunlight, do not expose to excessive heat. Store in dry place. Inspect insulin for unusual changes like frosting, clumping, or change in color. If you are traveling, keep insulin in hand-carried luggage and carry additional supplies. Barriers and solutions to self-monitoring blood glucose. Cost is the first barrier. To counter it, ensure correct testing technique to minimize wastage of test strips. Pain perception is the next barrier. As a solution, prick at the side of the fingertips and not at the finger pads. More nerve endings at the tips of finger cause more pain, or use finer lancet size. Instructions is another barrier. Thus, use pictures and illustrations for better understanding. Some patients see no value in monitoring. So, acknowledge effort taken to perform self-monitoring blood glucose by saying thank you. Thank you very much for watching.